In your healthcare facility, can your eyes tell you what you need to know when it comes to cleanliness? Is seeing believing? What if you could see with the power of a microscope? What would you see then? Would you still believe it was clean? The number of infections acquired in healthcare facilities is on the rise worldwide. According to the CDC, U.S. hospitals are treating over 165,000 cases of hospital-acquired, hospital-onset Clostridium difficile per year. In 2010, MRSA infections were estimated at 100,000 cases in the U.S., with more than 18,000 deaths. Current studies have shown the transmission of HAIs decreases with the implementation of enhanced environmental cleaning. Since microscopic contaminants can't be seen with the naked eye, how can you know if your cleaning efforts are effective? How can you develop protocols that keep your patients safe and your healthcare facility's good reputation intact? Fortunately, there is a practical solution that can give you the information you need to know: the 3M Clean-Trace Hygiene Management System. As your front line in the fight against HAIs, 3M developed this system to help you assess the cleanliness of environmental surfaces, surgical instruments, and flexible endoscopes. The 3M Clean-Trace Hygiene Management System gives you real-time data for monitoring and evaluating cleanliness. The Clean-Trace system enhances your cleaning practices to verify the efficacy of current methods. 3M provides online software for data tracking and trending. The Clean-Trace system is easy to use and delivers fast and accurate results. In 30 seconds, you can measure the hygienic status of high-risk surfaces, allowing for quick corrective action. The revolutionary technology of the Clean-Trace system works by measuring a molecule found in all living cells, adenosine triphosphate, more commonly known as ATP. When organic residue is on a surface, ATP is like a beacon indicating its presence. Once mixed with the chemical reagents in the 3M Clean-Trace ATP surface test, any ATP present in the organic residue will generate light. This indicates a potentially contaminated surface. The more ATP in the sample, the brighter the glow. Organic residue levels, normally invisible to the eye, can be measured precisely by the 3M Clean-Trace NGI luminometer. This measurement will be expressed in relative light units, or RLUs. One simple, quick swab can provide a rapid, objective measurement to accurately quantify surface cleanliness. The data collected is uploaded to the exclusive 3M Clean-Trace online software, which provides analysis with tracking, trending, and reporting. The 3M Clean-Trace Hygiene Management System assesses and monitors the cleaning practices of the following critical areas that are essential to your infection prevention strategy: environmental surfaces, surgical instruments, and flexible endoscopes. Environmental surfaces. Healthcare facilities are full of high-touch surfaces: bed rails, tables, switches, and frequently used equipment. Just because a surface looks clean, that doesn't mean it is meeting your facility's hygienic standards, because even surfaces that appear clean can have significant levels of contamination. The 3M Clean-Trace Hygiene Management System makes testing these surfaces fast, convenient, and accurate. Begin by sampling the surface using the 3M Clean-Trace ATP surface test. Activate the test and shake for 5 seconds. Place the swab in the chamber of the 3M Clean-Trace NGI luminometer. Within 30 seconds, the Clean-Trace luminometer will display a measure of cleanliness expressed in relative light units, or RLUs. By uploading and tracking the data using the 3M Clean-Trace online software, you can identify hotspots where repeated contamination occurs and adjust your cleaning regimen. You can measure the effectiveness of your hygiene management procedures. You can also maintain consistent cleaning protocols throughout your environment. Now, with the 3M Clean-Trace Hygiene Management System, you can know that the surfaces in your healthcare facilities are not only visibly clean, they meet your strict hygienic standards. Surgical instruments. Cleaning and sterilization of surgical instruments was one of the first areas where infection prevention was practiced. Cleaning is critical because residual organic material like blood, pus, tissue, and bone can inactivate disinfectants. Moreover, if a device is not cleaned thoroughly, sterility may not be achieved. Unless the organic material is large enough to be visible, it is virtually impossible to tell if it has been removed. The 3M Clean-Trace Hygiene Management System makes the cleaning verification of surgical instruments fast, convenient, and accurate. Using the 3M Clean-Trace ATP surface test, swab the entire surface of the surgical instrument. Activate the test and shake for 5 seconds. Within 30 seconds of placing the swab in the Clean-Trace luminometer, your measurement appears. The number tells you at a glance how clean your surgical instruments are. By collecting this data and using the tracking and trending capabilities of the 3M Clean-Trace online software, you can easily monitor the effectiveness of your cleaning methods, train technicians and staff on enhanced cleaning practices, and show the true effectiveness of proper cleaning. Flexible endoscopes. In a healthcare facility, the flexible endoscope is possibly the most challenging instrument to verify cleanliness. The 3M Clean-Trace Hygiene Management System measures the levels of organic residue of both the external surface and internal channels. Sampling the outer surface of the endoscope's bending section follows similar principles as environmental surfaces and surgical instruments. Using the 3M Clean-Trace ATP surface test, simply swab the distal end of the insertion tube. Activate the Clean-Trace surface test and shake for 5 seconds. Place the swab into the Clean-Trace luminometer, and within 30 seconds, your measure of cleanliness is expressed in RLUs. The Clean-Trace system makes testing the outside easy. But what about the channels within a flexible endoscope? The complex and narrow lumens simply cannot be directly inspected to determine cleanliness. Given how difficult they are to clean, it is highly likely they have unacceptable levels of contamination. After manually washing, prepare your flexible endoscope for sampling by using the appropriate connectors, caps, and plugs found in the sampling kit. Flush the selected channel or lumen with 40 milliliters of sterile water, followed by 60 milliliters of air, and collect the rinsate. Using the 3M Clean-Trace ATP water test, carefully dip the test into the sample rinsate. Immediately activate the test, shake for 5 seconds, and place the Clean-Trace water test into the Clean-Trace luminometer. Within 30 seconds, your measure of cleanliness is expressed in RLUs. Regular monitoring of the reprocessing procedure verifies that flexible endoscopes are being properly cleaned, ensuring patient safety. Now, with the 3M Clean-Trace Hygiene Management System, you can be confident that your cleaning process really works and your patients are getting the infection prevention they deserve. 3M Clean-Trace Online Software. 3M's Infection Prevention Division is on a mission to support healthcare facilities and their efforts to reduce the risk of HAIs. The 3M Clean-Trace Hygiene Management System has the ability to detect the presence of organic contamination you cannot see. This technology is transforming the practice of environmental hygiene and provides healthcare facilities with a real-time assessment tool. 3M is the first to offer you the Clean-Trace online software. With this service, data is directly uploaded from the 3M Clean-Trace NGI luminometer and securely stored. With the Clean-Trace online software, you are able to analyze your healthcare facility's cleaning practices with full tracking and trending capabilities and automated report generation. There are 7 different report types to choose from. You are able to organize the data and create reports for individual areas or your entire facility. These reports can be automatically sent via email to key stakeholders at regularly scheduled intervals or generated on demand for audit purposes. The ability to view your whole facility and its data trends allows you to create better strategies for improving the cleaning protocols in your facility. The impact that cleanliness can have on your patients and the success of your healthcare facility has never been more clear. The 3M Clean-Trace Hygiene Management System is the tool you need to give you the quantitative methodology to monitor and evaluate the cleanliness of your facility. With the knowledge the Clean-Trace system provides, you can verify that your current hygiene methods are working or if new protocols are required. The 3M Clean-Trace Hygiene Management System helps you maintain a cleaner facility and gives you the confidence of knowing that you have done your best to protect your patients and staff.